This video is for educational and informational purposes only. I'm a dental technologist, not a dentist. The content shared here is meant to increase dental awareness and should not be taken as medical advice. Always consult a qualified dentist for diagnosis or treatment of any dental problems. Hey everyone, welcome back to Mr. Teeth, your go-to channel for everything about oral health, dental diseases, and those hidden conditions that start right inside your mouth. Today, we're diving deep into something fascinating: odontogenic cysts, or simply tooth-related cysts. These are cysts that actually develop from the same cells that form your teeth. Sounds crazy, right? Let's break it down. What are odontogenic cysts? The word odontogenic means originating from tooth-forming tissues. Sometimes, the leftover cells from tooth development, known as residual odontogenic epithelium, start to form a cyst. A cyst is basically a small sac or cavity lined with epithelium. That's the thin tissue covering surfaces inside your mouth. Now, let's go through the main types of odontogenic cysts one by one, because each one behaves a little differently. Small blue diamond 1. Radicular cyst, periapical cyst. This is the most common odontogenic cyst, and probably the most important to understand. It usually develops at the root tip of a non-vital, dead tooth. When a tooth's pulp dies, bacteria move in, causing inflammation at the root apex. That's when the cyst begins to form. On an X-ray, you'll see a dark circular shadow, radiolucency, around the root tip. That's the radicular cyst. Why does it form? It starts when tiny leftover cells from tooth formation, called epithelial rests of malices, get stimulated by the infection and begin forming a cystic lining. Treatment: backhand index pointing right root canal treatment. RCT, backhand index pointing right apicoectomy. Surgical removal of the infected root tip, backhand index pointing right, or tooth extraction with curettage, cleaning out the cystic tissue. Small blue diamond 2. Dentigerous cyst. Next is the dentigerous cyst, the second most common odontogenic cyst. It usually forms around the crown of an unerupted tooth, most often wisdom teeth or canines. On an X-ray, you'll see the dark shadow attached to the crown, near the cemento-enamel junction, CJ. It happens when fluid builds up between the crown and the reduced enamel epithelium. Another developmental tissue. If it happens in a child, it's called an eruption cyst. Treatment: surgical removal, enucleation. In rare cases, it can turn into an odontogenic tumor, so early treatment is important. Small blue diamond 3. Lateral periodontal cyst. This one usually appears between the roots of vital teeth, most commonly in the lower premolar region. Unlike the radicular cyst, this one's not from a dead tooth. The tooth is still alive and healthy. It shows up as a small round radiolucent spot on the side of the root. Treatment: simple surgical removal. Small blue diamond 4. Gingival cysts. There are two types here. A. Gingival cyst of the adult, found in soft tissue near the premolars. It doesn't involve the bone, so no dark area shows on X-rays. B. Gingival cyst of the newborn. These are tiny white or yellow bumps on the gums or palate of babies. If they appear on the midline, they're called Epstein's pearls, and on the sides, Bond's nodules. They're completely harmless and usually disappear on their own with time. No treatment needed. Small blue diamond 5. Primordial cyst. This cyst develops in place of a tooth that never formed, usually where a wisdom tooth should be E.SO instead of a tooth. A cyst takes its place. You'll see a dark shadow, radiolucency, in the area on an X-ray. Treatment: complete removal of the cyst. Small blue diamond 6. Keratocystic odontogenic tumor, KCOT. This one's a bit tricky. It was once called a keratocyst, but later classified as a tumor because it behaves aggressively and often comes back. It usually appears in the back part of the lower jaw, mandible, near the ascending ramus. It's lined by paraceratinized epithelium, histologically speaking, and can spread quickly if not removed completely. KCOTs are also linked to a condition called Gorlin-Goltz syndrome, which includes multiple KTS basal cell carcinomas, skin cancers, calcified falx cerebri, a brain structure. Treatment: aggressive surgical removal, including the cyst and surrounding bone. Small blue diamond 7. Calcifying odontogenic cyst, Gorlin cyst. This one is rare and unpredictable. It contains special cells called ghost cells. They lose their nucleus, and keratin takes its place. These ghost cells can calcify, showing up as white specks, radiopaque spots, on x-rays that's how dentists identify it radiographically. Treatment: surgical removal. It usually heals well. Brain type: common location, tooth vitality, treatment: radicular root, apex, non-vital RCT/extraction, dentigerous crown of unerupted tooth. Not applicable: surgical removal, lateral, periodontal, between roots, vital, enucleation, gingival, adult/newborn, gums/palate, vital, usually none, primordial, missing tooth site. Not applicable: removal, KCOT, posterior, mandible, vital, aggressive removal, calcifying, various, vital removal. And that's it for today's episode on odontogenic cysts. Understanding these cysts isn't just for dentists. It's for anyone who wants to know what's really happening inside their mouth. If you learned something new today, don't forget to like, subscribe, and share this video to help others keep their smiles healthy.